Hello, everyone, and welcome to Digital Health Talks. I'm Janae Sharp. I'm the founder of Sharp Index, a nonprofit dedicated to improving clinician mental health. And I'm also the co-host of Digital Health Talks with Megan Antonelli. And today I'm thrilled to sit down with the winners of the Charlotte Innovation Day pitch competition. And they are going to share some of their story and their vision behind their company. And they are the team behind ForesightCares, a startup rethinking how we approach mobility, fall prevention, and everyday movement through visual assessments and guided interventions. And I loved their work. And falls are one of the leading causes of injury, especially for older adults, but also impact clinicians, caregivers, and patients across the continuum. What I found exciting about ForesightCares is how they're combining technology, movement, and science and accessibility to bring proactive care into your homes. So I would love if you could introduce yourself to our audience, tell us about your company, where you came from, maybe your past lives, how things are.
Sure. Hi, my name is Mona Azarbayjani. I'm the CEO and co-founder of ForesightCares. My expertise in human-centered design, and I worked with Hamid for several years. How we started was that his expertise was in the AI and in artificial intelligence, and my father went through the knee replacement surgery, and he wanted to see between the visits how his mobility is changing and how he's improving. So I was talking to him saying that there is no such a tool that can monitor and also look at the data and the progress data. And he said that with the visual assessment, that's his expertise, and he has been doing several projects. He said we can do it. So that's how we started.
Awesome.
Hi, my name is Tabkhi. I am CTO and co-founder of ForesightCares. Have been fortunate to work with Mono and the brilliant team that we have. Uh, our company is based on Charlotte, North Carolina. We have about 10 employees, working with talented people from AI, human-centered design, AWS, system engineering, data collection, and validation. Frankly, Mona and I are the face of the company. We have a large group of talented people that actually carry the company and do the actual work.
I love that. Recognition of the team is important. So let's dive into fall prevention.
So we decided to start a company to change this whole cycle from instead of waiting for the fall to happen, being proactive and be able to close the loop of the assessment and provide some real-time feedback to the older adults. What are the areas they need to work on?
Yeah. So does it assess some of the decline as well with those assessments, or?
Yes. So with the CDC, based on the CDC guidelines, which is aligned with that steady test, we assess their balance, the gait, their strength. And as they do the assessment, we can also monitor how they are doing over time.
Awesome. Awesome. So tell me more about this idea that most prevention solutions are reactive. Like, how did you go from that to the importance of everyday movement instead of just like recovery or high risk? Or how do you know what's important?
Great question. So, as I said, 40% of the older adults are at risk of falling, but only a very small number of them do that risk assessment before it happens. So this was the moment that there is a gap, and we wanted to change that process and being proactive, so we understand that how people are performing, so they can be assessed over time, and we can understand that there are gradual changes and that degrades that is happening, and measuring that in their own environment where they are, where the older adults are.
Right. Oh, that's nice, in their own environment, because that's where most falls happen. And also when you go to the clinician and all those things are seen in a certain environment, it's not really the environment that you live in. So that inspired you to make the change and to make this company. So you use visual assessment for everyday movement. And I don't know, tell me what that means in practice.
Ahmed, do you want to take that?
That's you. That's our technology question. Let's go.
Sure. Well, the key innovation here is performing intelligent processing on the phone or iPad. So basically, or AI leverages, existing built-in cameras in your iPad or iPhone and whatever processing powers you have. So it on the fly, it analyze the motions and analyze the gait, balance, the strengths of older adults on their phone. And it focuses on CDC steady test, which is the stopping falls and injuries in older adults.
Mm-hmm.
So basically, the key innovation here is let's automate CDC steady test and make it accessible and affordable to everyone at their comfort, and also respect privacy. And it's very important for acceptance of the technology. So rather than having, surveillance cameras or storing information and sending them somewhere else, the technology works more in an on-demand based approach, anywhere, anytime. It does not mean continuous. It means that you can use this system and this app anywhere, anytime at your own comfort and without the need for any external hardware. And it just analyzes your motions and give you a fall risk score that can be then used for proper, follow-up or prevention practices.
I like that. How does it use AI? Like, is the AI helping with the simplicity or helping with accuracy? Question. What role does artificial intelligence or computer vision play in that, if any?
Yeah, so the artificial intelligence definitely play a big role, but it's not everything. As you see with recent advances in
That's
AI.
That's a big quote, right? Can we quote you for a second? You got to look at the camera and be like, it plays a role, but it's not everything. Right?
Exactly. That's actually, it's every day we realize it more and more. While at the beginning, this company started as an AI-based company, we realized that AI is just a small piece of what we're building, and a lot of that is about access, transparency, trust, and user experience.
Right.
And I really like to emphasize on the user experience part, which actually is Mona's expertise, and she can talk in days and nights for you about that. But the key idea is how we build something that design with and for older adults.
Right.
And there is a really lack of user experience research, especially when it comes to technology and AI, how to interface that with older adults and empower them and building a system that they can trust and use it. I would say that that's the biggest value of the company, and that's the biggest factor that helps us to scale and achieve that and maximizing our reach at an extremely low cost.
I like that. Let's talk about that a little bit more when we're talking about who we're designing for an older population. There are some stereotypes about older populations. Anyone who's helped their dad set up a phone, which my dad's good at that stuff, but not all dads are. So are not all dads theme. Like, how does that work for a company where you're trying to use technology to help that age group? Are you seeing any barriers in terms of engagement or utilization? Or, what's the magic trick here for technology companies for how to make that effective?
Yeah, the engagement is actually a key. It's if you ask too much and they and don't give back, that's going to be a problem. So what our AVA created is that AVA is asking very little. It just takes a few minutes to basically to do the assessment, and then it provides it. And all the adults likes to have like paper, for instance. So it sends you a PDF of based on your assessment. Here's like what you need to do, areas that you need to work on. So it's not giving you a score that you don't know what that means. It's giving you a specific feedback. This is what we noticed in your balance, in your gait, in your analysis, and here's how you can address it.
I like that. People love to see how they're doing. People love specific directions. I'm thinking about when you said that, how does that assessment and how does your technology fit in with the care team or with clinicians? How do you see that integrating into workflows?
Alma, do you want to take that?
Sure.
Because people want to know if it's going to give them more work.
Yes. So one thing that we are very excited, and it's more about the business side of it, is at the end of the day, people and clinicians, and in this case specifically PTs and physical therapists or occupational therapists, those are the people that need to promote this app, needs to encourage the older adults or their patients to use this app and work on their fall prevention. But the challenge is, and has been, is there is not enough incentives for fall prevention practices. And one key is lack of integration. So the current healthcare system designed for rehab, basically the billing mechanism, the reimbursement, all of those incentivize falls. I'm not saying that
right. I mean, kind of.
the Medicare core is codes are responsible for falls, but they are focusing on fall caused rehabs, post surgeries. So what AVA has tried to achieve, and we have been extremely fortunate because in the last 2 years, and specifically this year, we see significant changes in the Medicare and CMS, especially when it comes to RTM, remote therapeutic monitoring codes, that they started to award PTs for fall prevention practices and giving them reimbursement. However, there is no app or technology to drive as a vehicle these policies and enable PTs to benefit from these new reimbursement codes and increase the quality of the care, at the same time getting compensated for their prevention practices rather than waiting for fall. So AVA provides that. And as part of that, of course, integration into EHR systems is essential, which we are working on, as well as the billing mechanisms is important, which AVA is about to support both sides of integration. So we are hoping, and we're quite confident about it, that it's not going to disrupt the PTs or PCPs, current care flow. Rather than it helps them, and it helps them to actually tap into new reimbursement code and change their business models from fall reaction to fall prevention. And I guess that's what federal government and CMS and Medicare are hoping for. And AVA, in my view, is the first vehicle for these new policies.
That's great. For them to actually promote better health. Let's talk about outcomes. What are you excited about? What's going great? What have you seen?
So the best outcome that we are very excited about is that fall never happens. But through some of the pilots and some of the work we have done, we see that the fall risk has been reduced by 40% in the kind of the communities, the IL communities that we have done. So we are hoping that all those 3 million or 4 million adults, older adults, that they see the ER every year, we are hoping to prevent those that are inevitable. We can reduce those events. And at this point, the decline of that between the first assessment and the last assessment that we have looked at over 4 months shows 40% reduction. It's not just because of AVA, it's that also because that they have been seeing those progress over time, and the areas that they need to work on, and they have been participating in all of the exercise programs that their community is providing. So this is a kind of everybody's work that they They can see what are the areas they need to work on, and then let's just get that into the routine.
Yeah, it makes it easier to comply, which is something that's important. From their perspective, where's the aha moment? When do they realize that this is valuable, both clinicians and patients?
For the
What have you seen? When are people like,
Yeah, go
you guys are
ahead.
my favorite?
Oh yeah, I feel that, and Mona, I'm actually curious to know what is your perspective on this. For me, the aha moment it first was when we can do objective assessment. It's consistent, right? It's not subjective, right? You're not eyeballing things, which is the state of the art right now. Uh, and the second part, which happens recently, when you see you have thought of a technology 2 years ago, you spend the last 2 years to develop that and a product, and then the new policies coming from federal administration are amazingly aligned and support what you have designed. It's an aha moment for us. It's really the best validation you can get from your products.
Right. When that's the direction people have noticed that it should be going. What do you think?
I mean, I agree with what Hamid you said about the aha moment, and also like as a children. So because that's kind of how we started, is that you can also, I think the person or the patient can see how their progress over time. That's where they are like very happy about the product. Is that there's no such a tool that you can see how you're progressing over time. So my dad went through the knee replacement, and he wanted to see between the PT visits how he's progressing, his kind of like motion, and the such a tool can give that objective data instead of being subjective, but you can see he's improving. But how do we measure that? We measure that progress. Or in other case, how do we measure that mobility is declining? So I think that having that tool is very exciting for not just the PT, but also the users.
Mm-hmm.
Oh, if I may add something more, I actually forgot about it, Mona.
We're ready.
I guess you're gonna share this with me too. Initially, we were thinking of designing, those passive monitoring surveillance cameras to achieve
Right.
this goal. But but we were really worried and concerned about privacies, hardware cost, access. We felt like, oh my God, this product going to be very expensive, going to be too much logistic to ship cameras and then install it. And then what about the privacy concerns? How do you build a trust? And then I remember one day we were brainstorming with Mona and we felt that, well, why we don't put everything into what they already have, which is their phones and their iPads. It has the camera. It can do information processing. Nobody has done that yet at the level we are doing. And I feel that from the product design and development, that was definitely an aha moment for a company that changed the trajectory, by a big margin.
Yeah, you don't have to remake the technology or the hardware that already exists.
Exactly.
I like that. And those are the things people already know how to use them.
Yes,
Maybe.
and everybody have them, so it's not that and we could really reduce the cost and increase the access, and that's what we really care about it.
Yeah. Decreasing costs, making things more accessible, making it so people follow their plans. Let's talk about the future, like where you're going from here. What does the future look like for you? Is this something where we're talking about how this will change mobility, aging, or tell us?
Our kind of like our vision is that regular mobility assessment and screening becomes a routine, and that's like similar to like that blood pressure that you go to the doctor for your PCP and they do the blood pressure and all that. This becomes something that we are shifting everything towards that prevention. And also that all the adults, they can change those changes in their mobility early so they can stay active and they can live independently for longer time.
And when that success, what would that success look like at scale? Would it be that everyone does that, like in every EHR, and you know, or do you know yet?
I would say maybe not the ultimate success, but the one that we are definitely moving toward is seeing that for me, success is we have a sustainable business model across fall prevention. So if we create this full chain support and encouraging PTs and clinicians and PCPs to do more fall risk assessment, of course, it would be great for healthcare system, but at the end of the day, it's a sustainable practice that can, pay itself and increase the quality of the care and overall reduce the cost because we're going to have less falls. For me, that's the success.
Yeah, the success is fewer falls and more people living healthier, longer lives. I love that. So you just won this competition. What should we be waiting for? What's next? More competitions, more winning. Where will we see you next?
Yes, more pitches. We are also if we're trying to like get this to the hands of the users. So that's we are doing. We are attending these conferences that for the older adults and the caregivers are joining the PT conferences. We are doing more pitch, and those are what we are doing right now and in the next couple months.
Awesome. All right. Well, thank you both for your work and for sharing your vision and for being part of the Charlotte Innovation community and part of Digital Health Talks family. And to everyone watching, if you care about the future of digital health and if you care about reducing falls and prevention, we hope you check out our friends, and we're looking forward to watching this space closely. Thank you for being part of Digital Health Talks.
Thanks for having us.